Honorable Minister of Information and Culture, Permanent Secretary, Directors here from the Ministry of Health, gentlemen and ladies of the press, good afternoon. This is the press briefing from the Federal Ministry of Health in respect of the COVID-19 response in Nigeria. An update for Monday, the 23rd of March, and as of this day, we have recorded 36 confirmed cases of coronavirus disease in Nigeria. Of these 36 confirmed cases, 25 are in Lagos, 6 are in Federal Capital Territory, 2 are in Ogun State, 1 in Edo, 1 in Ekiti, and 1 in Oyo. 26 of them have had travel history to countries with a high burden in the last 2 weeks. 6 are contacts of the confirmed cases. And for 4 of them, we have not been able to trace recent travel history or trace known confirmed contact. Unfortunately, we recorded the first death from COVID-19 infection in the country. This was a Nigerian who had underlying illnesses and died due to the complications on the 22nd of March 2020 in Abuja. He had just returned from treatment in the United Kingdom. In summary, as of today, the 23rd of March 2020, 36 cases have been confirmed in Nigeria. 2 have been discharged after successful treatment, and 1 death has been recorded from COVID-19 in Nigeria. Of the presently 33 active cases, 32 are clinically stable with mild symptoms only, and 1 patient is dependent on oxygen. The Nigeria Center for Disease Control is working closely with state governments of all affected states in Nigeria to carry out intensive contact tracing. Through intensified contact tracing, we have been able to promptly detect many cases. I strongly urge all health facilities to be on high alert from the state, local government, law enforcement authorities, and community leaders and private hospitals to fully cooperate and to be able to inform the NCDC through the dedicated number of any case of someone who has fallen ill and has recently been out of the country in the last 14 days, or has been a close contact of someone who has been out of the country. Following declaration of a pandemic by the World Health Organization and the increasing spread of COVID-19, the federal government of Nigeria, through the Presidential Task Force on Control of COVID-19, has employed diverse strategies to interrupt and halt the spread of the disease. To this end, a ban was placed on all international flights effective from today, the 23rd of March 2020, with the exception of emergency and essential flights. These were not easy decisions to make, but have become necessary in view of the changing development in our country as we witness more and more confirmed cases coming from outside the country. More measures may be instituted by the federal and state governments in coming days as the situation will demand. Contact tracing, that is to say, finding the contacts of those who have been outside the country or those who have been in contact with them, is to identify all persons that require medical attention or require isolation. The Federal Ministry of Health is working with states and Presidential Task Force to review response activities and institute measures to protect the health of Nigerians. The Multilateral Emergency Operations Center, led by NCDC, continues to coordinate national response activities. NCDC has also launched a communication campaign that is titled Take Responsibility. This is a call to all Nigerians and residents of Nigeria to join forces and be proactive in taking greater individual and collective responsibility in preventing and controlling the spread of COVID-19. I urge all citizens and all businesses and all professional bodies, media houses, and all committed Nigerians to take ownership of this campaign by developing and communicating prevention messages around all the criteria that we have listed. Frequent hand washing with soap under running water or using an alcohol-based hand sanitizer. Coughing or sneezing using a tissue paper or using a handkerchief or into the sleeve of your shirt or dress if you do not have this, and disposing of your handkerchief or your tissue promptly. Avoiding large gatherings and close physical contact. Cleaning all surfaces frequently with disinfectant. Getting information only from official sources. Self-isolating for 14 days on return from international travel. And call the emergency call number, which I will repeat, 0800 9700 0010. And if you develop any symptoms or any distress, call that number. Very importantly, I urge all Nigerian residents to take self-isolation and social distancing very seriously in order to prevent the spread of this disease in our country. Social distancing reduces the risk of someone who you do not know may be infected or who may not know that he or she is infected from infecting someone else. Therefore, ensure you maintain at least 2 meters, which is about 5 feet of distance, between yourself and anyone who is coughing or sneezing. Stay at home if you feel unwell and have any complaints that make you suspicious of your health. NCDC hotline, as I have said, is available round the clock, day and night. You can call at no cost. It is toll-free. So we urge all citizens to use this line only for legitimate purposes. This is not for joking. The fight to contain COVID-19 is a call for collective action, and we call for collective responsibility on all sides. We will maintain real-time updates on all new cases through the COVID-19 ncdc.gov.ng platform and continue to provide updates as and when they become available. The Ministry of Health reiterates its commitment to ensuring the control of COVID-19 outbreak in Nigeria, and your full cooperation and support in this fight is needed. To the media, this change in venue, as I've said, is in response to the advice we are giving you now to observe social distancing, avoid crowding. We will migrate to more digital platforms for future briefings to further reduce potential exposure for us all, or find conducive atmosphere to do the briefing and give you the opportunity to ask questions, as we shall do now. Thank you.